Welcome to Fertility Health Hub's podcast. I'm Eloise, the founder and editor, and each week we bring you expert interviews, reader stories, holistic products, and more. Subscribe to our podcast for free so you never miss an episode. Good morning. Today's guest is the medical doctor at ExSeed Health, Dr. Fatin Willendrup. She is Head of Medical Affairs. Good morning and welcome.
Well, hello, and thank you for having me. I am a medical doctor from the University of Copenhagen. I have been a doctor for over 10 years, and I'm also a former fertility patient myself, having conceived 2 children with ExSeed back in 2014 and 16. That was due to low sperm quality and PCOS issues. Yeah. And I joined ExSeed Health 2.5 years ago, mainly because I wanted to, through my experience of infertility, help other people that have troubles with fertility issues.
Could you tell us a little bit about ExSeed Health? What is it?
Well, ExSeed Health is a platform for men to accurately test and actively improve their sperm quality. We have a high-class microscope technology that allows men for advanced tracking of sperm quality at home. And through algorithm, we also provide them personal guidance based on lifestyle questionnaire. It's also a company where we work towards raising awareness on male fertility, because it's really important also to have focus on the men and not only on the women.
Absolutely. And don't you find that sometimes men can be tested a lot later on down the process when the focus seems to be on the women?
Yeah, exactly. That's what we see sometimes, and maybe also that the women take action long time before the males, and they try to improve themselves and see where the ovulation is, but then finding out later that the actual problem is the male, and that's something that we want to avoid. We want them to test at the same time and find out if there is an issue also from the male part as well, so that they can do something about that.
100%. And how does the male fertility test work? What do men do at home?
Well, the fertility test itself, the ExSeed test, is at home test. A person can buy it online through our website and download free ExSeed app. After that, they find a time at home and where they can produce a sample, and after that, they should let it rest for 15 to 20 minutes. They have to mix the sample as well as they do in the laboratory. Afterwards, transfer a drop of the semen to a glass slide, also provided in the test kit. And the glass slide is afterwards inserted into the device. And they use their mobile phone to record a video, which is sent to the cloud and analyzed with our algorithm. Within a couple of minutes, they have the result of the fertility test. They will get the result on the volume, sperm count, motility, and also the total motile sperm count. That is the number one important thing to know when evaluating male fertility.
And how reliable is it? Do you have statistics on that?
Yeah, we've done a lot of testing also, and it's over 95% accurate. Actually, for the sperm count itself, it's 98%, and for the motility, around 92%. But the overall is above 95%. So it means that in over 95% of the cases, you will have the same accurate result as the one you would have in a fertility clinic.
That's amazing. And just because I know that you know, but for people listening, my husband had results of 0 sperm, azoospermia, from a fertility clinic while sitting there, and I wasn't even with him because of work. What do you think are the benefits of doing a test like this at home versus a doctor's office or a fertility clinic?
Well, first of all, the opportunity of doing a sperm sample at home, it can bring many males to testing because there are many males that are hesitant to go to a clinic just because they don't want to do a sperm sample in the clinic. They think it's embarrassing. They don't want to. They may be afraid of knowing that what the result is. But at home, the benefit here is that you can do it quite privately, and you can do it whenever you want, and it's fast and it's accurate result. It's easy to do within a couple of minutes, rather than going to a clinic one day and then a couple of days afterwards. Some males just sit in anxiety and don't know if they're kind of have bad or good quality, but here you will get the results within minutes. No waiting list, no referral from a GP, and no stress, because they will know quite fast. And if they find out that maybe there is a problem, we also have offers. They can contact ExSeed Health, both if they have technical problems with the test, but also right away if they find out that there is an issue with the sperm quality. Here we recommend them to test again within a couple of days, just to find out if the quality is really low, if there's has been some impact, maybe if they have done the test wrong, or they have not been absent from ejaculation. But if they find out, we give them concrete actions, either to improve sperm quality, or if it's really low, we explain to them what the result means, and if needed, we refer them to a fertility specialist.
So if someone had the result like my husband, where there was 0 sperm, what would you do? Would you refer them to a urologist or a fertility specialist?
First of all, because we have a recorder of the videos, a video of the sample, we will double check, of course, to see if everything is done right, and if there is no sperm cells at all, we would recommend them to seek help. Right away. They can do that actually through the app. They can find clinics that are nearby, or we would also recommend them some in their area. It's good that they feel that there's somebody to talk to. Of course, they talk to us in the beginning, where we explain what is this about, what does it mean, but they have like the second line help is their fertility specialists.
Absolutely. What about emotional support?
Of course, it's really difficult to receive a bad result. I remember that from my own experience, because my husband also received a bad result. It's really important that we explain to them what does that mean, because the low sperm quality can be caused by many things, many conditions. Also, some conditions that you can do something about, other conditions maybe not. But there is something that you can do, and especially if you want children, there are also lots of procedures that can be done. For example, if there are no sperm in the actual sample, but you can maybe find sperm cells in the testicles, and you can do a procedure called TESA, where you actually take the sperm cells directly from the testicles and use IVF to conceive children. So it's not over. It's not totally over if you don't have sperm at all.
That's exactly the procedure my husband had. So if anyone is going through that, please feel free to message, because it can be a daunting time. But as you said, there are other options and things to look at during that process.
Yeah, and we recommend them also to talk through, all of this. It can be really hard to hear such a bad result, but it's important to talk to your partners, and we also offer them to email us if they have other questions. We would like to support them as much as possible, both with their actual situation and what they can do to stress off, and also to the referral to the right place at the right time to get help. And also to explain to them what this means, because sometimes at the doctor's office, the clinic, or GP, they don't have time to explain about these specific things. But I feel that no matter the situation, how bad it is. But if you get the right explanation, it helps.
And why do you think that it is important to know about sperm quality, and what are the statistics around the test coming back kind of okay, or might need some help, or need to be referred to a specialist?
Well, we know that 40% of the cases of infertility are associated with male factors. So we know that there are many males out there that have low sperm quality and should actually maybe test early to find out. We also know that in the Western world, there has been a drop of 50% of the overall sperm quality for the last 40 years.
Wow.
That's really high, and also we know from scientific articles that a third of the young men have a sperm quality that is so low that they would most likely have experiencing trouble with their fertility. And you never know if it's the guy who is fit for fight and eats 100% healthy, or if it's the one without any exercise. So you can't see if a sperm sample is good or bad, or if it contains sperm cells at all, just by looking at it. You really need a sperm analysis to assess male fertility. So though there are many different clients, we have customers that only buy just to test and to know if the sperm quality is good or bad. We also have people buying the product to where they are in a fertility treatment, but they want to improve their sperm quality, and therefore buys a kit. We have a kit with 5 tests, so they can take one test before maybe changing their lifestyle, and during this fertility journey, and also after, to see if there is some result of their actions. And it's a really good, rewarding feeling to feel as a male that they can do something actively to change their lifestyle and improve their sperm quality. So that is that's a really good feeling as a male, instead of just being parked next to the woman, as the doctors have been doing to the males. You have a low sperm quality, we park you here, you can't do anything. But actually there are a lot of things they can do, and men feel empowered to participate in the fertility journey together with their partner.
Why do you think that these numbers have risen in terms of sperm quality not being as good as it used to be?
Some of the answers we can find are because of the Western lifestyle that we have. The lifestyle with long days of sitting down in the office, not much of exercise, unhealthy diet, fast food, and not enough vegetables, not enough antioxidants in our everyday life. Another explanation could be that there are many males that have STDs, sexually transmitted diseases, and that is also a factor that could negatively impact sperm quality. If not treated, they can have a bad influence on sperm quality. And if we see, there are many reasons, and some of them are not treated at the right time, and therefore the sperm quality is decreased.
And please tell us about your personal fertility journey.
My husband and I, we actually started early. We got married when I was 24, and that was the same year as I was finished as a doctor, and I really wanted 2 children before I hit 30, so I really wanted children, and didn't even think that should be a problem. Also because I am from Iraq, and I haven't had any my mother and my family, there hasn't been any fertility issues at all. We tried for 3-4 months and nothing happened, but as a doctor, I was of course curious, and didn't want to accept that this is not happening to me right away, because I really wanted it, and I was also quite healthy. I talked to my GP, and he referred me to a gynecologist who found out that I had PCOS, just like that. And he recommended me to also test my husband because we might experience trouble conceiving. And within the first half year of trying, I also got my husband tested, and he also had problems because he had low sperm quality, and we couldn't believe our ears. We were going from being the happy couple, just got married, and didn't think of any problems that could be with our fertility, to both having issues. And that started a long period of almost 2 years where we went through insemination and afterwards ExSeed, and also long waiting list and stress and a lot of hormones that I had to take, and that really was unhealthy for our relationship. But luckily we conceived, I think 5th ExSeed with my first child, a boy, and afterwards I knew that there was some trouble, so I didn't want to wait, and went to a fertility clinic where we conceived. But that was a lot easier than the first time. I think my body maybe knew what getting pregnant is, and also we didn't stress as much as the first time, and we did also some lifestyle changes. But then we needed ExSeed also to conceive the second time. And then we forgot all about it because now we had a boy and a girl. We were happy. But I thought maybe there was a chance that I could be pregnant again. So just for fun, we improved our lifestyle a whole lot, and we took antioxidants, and just having fun trying going for another pregnancy. And last year we got pregnant naturally, and now we have a girl, 6 months old, and that was amazing.
Wow! So do you think that was from the efforts of changing your lifestyle?
Both from the effort, and I think that we didn't stress about it at all. And also my husband, because I have also tested him with ExSeed because of my my work, and I can see that his concentration, his motility is improved a whole lot. And his main problem, I think it was because of overheating of the testicles. He plays football a lot, and he had some really tight shorts wearing during the 3 times he went to soccer training, and he removed that. He did all the right things as the ones we recommend in ExSeed: no overheating of testicles, eating the right diet, antioxidants, less stress in your everyday life. And I think that's it, because we haven't done anything else than that. So that's amazing.
And so passing on, and so working in this field must feel amazing when you see what a difference it can make from people understanding their fertile health, I guess, and trying to optimize that.
Yeah, exactly. And we also searched for, how to test sperm quality at home back in 2013. But back then there wasn't that many home tests and advisors and companies that offered this like today. So I'm really glad that there has been a huge revolution just within the last 7 years in this area, and that helps many couples out there experiencing infertility.
Absolutely. So, I mean, we've touched on this, but what would be your key words of wisdom for couples or people who want to optimize their chances of conceiving?
First of all, I would recommend everyone that are thinking about children to get tested in the early stage, so that they don't go through several months of trying and not succeeding. So both for female and male, just a quick fertility test. It could be at home test. It could be also a talk with the GP they have, maybe how to optimize, but also to start taking antioxidants and make sure that their nutrition is balanced with a lot of vegetables and fruit. Cut off, of course, bad habits like cigarette smoking. If they drink a lot, they should minimize it to maximum 14 units a week. So just living a little more healthy, exercising, that has also been proven to improve male fertility. And if the man feels that there is something in his testicles, that could be if there is a lump or some pain or sexual problems with erection, that should also be assessed in a clinic, just to have a clear idea of if there is an issue and what they can do about it.
It took me a while to get my husband to go to a clinic to get tested. For both of us, he thought that I was worrying about nothing. So what would you say for women who want to ensure that the man is on board with getting checked?
As with my own story and your story, females tend to seek help a lot earlier than the males. That's just nature, because the motherhood maybe is stronger sometimes. But I would really advise the females to talk openly about this issue with their partner, and making it, not making it a project, but a way of having to do something together as a couple, because it is both the responsibility of the female but also the male to know if their fertility is right, if there's something that they can do, and also don't stress about it. But I would speak openly and say that instead of maybe going to a clinic, they should make it to something simple. They could maybe talk about the possibility of at-home testing. That's a really easy, quick fertility assessment at home. And if there is fertility problems, maybe also have a plan B of where can we, what do we do then, and who do we talk to. But as females, I would recommend that they talk openly. Then suggest the males that this is also something they should take care of, because the statistics say that almost half of the issues are because of male fertility.
Absolutely. I couldn't agree more. And so if people are interested in testing at home and looking into the kits that you provide at ExSeed Health, how can they find out more about them, and how much are they, and where are they available to buy?
The ExSeed test kit is available on our website on www.exceedhealth.com, but also on Amazon and through our partners, and also online pharmacies. It's also available. You can find it by just Googling ExSeed Health. Through our website, we also have a lot of blog articles where you can read about male fertility, ask us questions. We also have a fertility quiz. If you as a male want to know if you might have trouble conceiving. Mainly we sell it on our website, and it is delivered very discreetly. And we have both 5 test kit and 2 test kit. The 5 test kit is actually the most popular because it's important both to test male fertility, sperm quality, but also to track it, because there is a variation in sperm quality over time. So just because you have a high sperm quality now, you might not know, within the next 6 months or 1 year if it's the same, because there are also factors that can have a negative impact on sperm quality. But if you just want to check, the 5 test kit it costs £149.99 pound. The 2 test kit, if you just want to check, or you just wanted to buy it to your husband, that could be a really good start. It costs £74 pound. And we also have a refill kit if you're, of course, interested in continuing with tracking.
And also through Fertility Help Hub, readers can get a discount. So I'll include all of the details for that in this description. And lastly, what are the plans for ExSeed Health?
Well, we work with, of course, increasing awareness on home sperm testing. We work to improve our testing methods to help people through our partnerships with fertility clinics and online fertility companies and forums like yourself. And also we do a lot of clinical studies on male fertility, because now we have the chance of at-home testing, and it's easier to go to than going to a clinic. And we will of course like to offer that both to researchers and key opinion leaders on male fertility, but also do some studies ourselves to find out exactly what lifestyle factors have the most impact on male fertility. What can we do? Is there a new area that we should investigate within male fertility?
Amazing. I look forward to seeing what progresses from here.
Yeah, we have a lot of things going on, many projects both in the UK but also internationally, and it's a pleasure to work in this area, because we can make many people happy, both through the home testing, but also through the blog articles and the recommendations and the advices that we give. Many people like the approach of the personalized guidance that we give, and of course we do that because no two couples are the same. So we find out what couples really need, and then we provide them with the right information at the right time.
Amazing. Thank you for such a useful explanation. And if anyone has any more questions, they can get in touch with myself or with the team at ExSeed Health. So thank you for your time today.
You're welcome. Thank you for having me.